My name is Teresa Lelash, and very early in the morning on February 2nd, my husband awakened me and told me he was having chest pain and told me, "You have to hurry, you have to drive me to the hospital." And I just said, "Why am I driving you? Why are we not, taking an ambulance?" And quite fortunately, I think he then passed out. And I had to call an ambulance because everyone told me if I'd driven him to the hospital, he would have died on the way. So
it was the EMS people from Reading that responded very, very quickly and got me up here to the hospital.
Probably about 5:30, they came and they told me that at that point they knew what was going on, that he had a tear in his aorta and that he was going to require surgery immediately. So there was no ifs, ands, or buts. I met a lot of the people from the cardiac team, and they kind of tried to fill me in on exactly what was going on. At that point, he had been sedated, so they could do a CAT scan. That's how they figured out what was going on, obviously. And then they had to kind of let him come back, awaken, and see what his status was. And about that point, I then met Dr. Pasick, and we knew that he would be the one that would do the surgery. I felt comfortable, I felt like he knew what he was doing, and I think that put me at ease. It was clear to me more after the fact that they were telling me, this might not turn out so well, but it just never entered my mind. I think maybe seeing his confidence and the team in action, I just felt like, everything was going to turn out okay, and fortunately it did.
I'm here, and most doctors tell me you shouldn't be here anymore. Other doctors who I know, and I tell them, okay, yeah, I had aortic dissection. It is very rare. Most people who are right by a hospital and have it die. And I was in the boonies, and it took time to get me out of there and get me up here to the hospital, so it really was quite amazing.
I was born here, and both of our children were born here, so Danbury Hospital is, I guess it's my first place, so that's where I come from.
There is no question. We would not have been able to access any other hospital, and it just so happened that we accessed Danbury, and that they were really set up to handle it, and to handle it well. When you're really down and out, and I was down and out, it's important. A smile or someone saying, "Hey, how you doing?" Makes a big difference. And then later for the cardio rehab, they've really been good. It's almost like they know what you're going through, although I don't think any of them, had the same type of, had actually had it, but they've dealt with enough people to know what they should be doing, how far to push them, and it's really very impressive. That's what I was always planning. I'd retire and do some things that I didn't have the time for normally, and now I've got it. Fortunately, otherwise I would have, I would have worked and then dropped, and that's not a good way to go out. You really want to finally get to do some of the things that you want to do.